thyroid cancer also becoming more common now, Dr. Saptarishi?
Thyroid cancer is becoming more common. Mortality related to thyroid cancer fortunately has not gone up. So thyroid cancer is one of the most treatable types of cancer.
Given the sudden uptick in the thyroid cases, right? And we see every third woman almost taking a thyroid pill. What is really the root cause?
Sometimes the water quality, the amount of pesticides, the chemicals, they all play a role. How the pollutants and the pesticides and the chemicals are affecting the hormonal glands.
Can thyroid disorders lead to fertility issues or ability to conceive?
Yes, but they are treatable.
What is your take on good diet for hypothyroidism?
See, autoimmunity do not have a proven connection to diet. Once somebody has got a thyroid, so the diet does not actually play a role because the gland has already been damaged because of autoimmunity.
If I have hypothyroidism and I am on a daily pill, do I necessarily need to take the pill forever?
Most probably yes.
Good evening everyone, this is Khushbu Agarwal, founder at Zyla Health. I have the privilege of hosting with me today Dr. Saptarishi Bhattacharya, renowned endocrinologist and diabetologist practicing in New Delhi. Dr. Saptarishi has 24 years of overall experience and a trusted name in the management of hormonal disorders ranging from diabetes, PCOD to hyperthyroidism. Today we are going to talk about a very, very important gland, small gland, big functions, the thyroid gland. Dr. Saptarishi has an MBBS and MD in general medicine from the Maulana Azad Medical College, New Delhi, and specialized in endocrinology from the very prestigious AIIMS, New Delhi. Sir now practices at Indraprastha Apollo and has a leading practice across metabolic conditions. Thank you, Dr. Saptarishi, for joining us
Thank
today.
you for inviting me.
Great. So, Dr. Saptarishi, before we start, we had spoken earlier and you mentioned there are a number of myths related to hypothyroidism, right? Why don't we burst the myths first, one by one, in a rapid fire round?
Yeah.
And post which we'll go into the details.
Sure.
Maybe it'll be interesting for our audience to uncover some of these myths. So I have 8 myths for you and would love to hear a yes or no for them, and then we go into the details. So Dr. Saptarishi, do thyroid problems always lead to weight gain?
No.
No. Are men at risk of thyroid disorders just like women?
Less.
Less.
No.
Should thyroid patients avoid soy products completely?
No.
No. Cruciferous veggies, friend or enemy for thyroid health?
Neutral.
Neutral. Can thyroid problems be reversed with diet alone?
No.
No. Can thyroid disorders cause hair and skin problems?
Yes.
Yes. Can thyroid disorders lead to fertility issues or ability to conceive?
Yes, but they are treatable.
Yes, but treatable. And the last one. If I have hypothyroidism and I am on a daily pill, do I necessarily need to take the pill forever?
Most probably yes.
So answer is yes. Thank you so much, Dr. Saptarishi. I think a lot of myth busting happened there, and the audience may be confused as to what just happened to our usual beliefs. So what we'll do now is we will go into the details one by one. Right? Thank you for being such a sport. Right? Being a doctor answering a rapid fire. So, Dr. Saptarishi wanted to first start, before we go into the details, wanted to start with really understanding the thyroid gland, right? It's a beautiful gland, very visible, but very few people know that you can actually spot it on your neck. So, if you could just help the audience understand as to how you spot the thyroid gland.
So again, so this is a very small gland. Normally, it won't be visible. So if you have an enlarged thyroid gland, then only it will be visible. It's here. So sometimes patients do come to me, I have a swelling here, this is because of thyroid, swelling there, this is because of thyroid, this is not. So this is just, if you have the Adam's apple, just below that it's the thyroid gland, in the middle of the neck, and it's butterfly shaped.
Okay.
So it slightly goes to the lateral side. But if there is any swelling, so it becomes visible. So if it's normally you won't get to see it, but if somebody has a diseased gland, which used to be very, very common earlier. So when there was iodine deficiency, there was no salt iodinization, so it used to be so we used to see a lot of cases of goiter.
Inflammation.
Swelling of the gland because of iodine deficiency. Thankfully, we don't see them anymore. So this is, in one word, this is here.
Okay, so below the Adam's apple, butterfly shaped, and here, and you mentioned given we have sort of managed the iodine deficiency, we don't see so much swelling or
right.
enlarged glands, and that is because of salt.
Salt
coming in
ionization.
with iodine.
Right,
Yes.
right.
Okay, great. So now we know that the thyroid gland is located here, and all that we will talk about today is thyroid health. Great. So, given that Dr. Saptarishi mentioned is very close to the neck or a voice box even, are there any symptoms which occur early on if someone has thyroid issues with respect to their voice or anything else?
See, usually thyroid has, since we are going to go into the details of the gland, so maybe we start with by understanding what are the basic thyroid diseases. So the most common will be hypothyroidism.
Okay.
That means there is an underperformance or underfunctioning or undersecretion of the thyroid hormone from the thyroid gland. So that is the most common. So 95% of cases of thyroid disorders which we see will be cases of hypothyroidism.
Got it.
The other variety is where the gland starts producing more hormone. So that is called thyrotoxicosis, or some varieties are called hyperthyroidism. There the metabolism gets enhanced, the gland is producing excess hormone, so the person might lose weight. But that is relatively less common than hypothyroidism. The other group of disorder is which might be associated or might not be associated with problems of hormone secretion is the thyroid swelling.
Okay.
In one word, it's called goiter. So again, there will be lots of varieties. So somebody might have a benign goiter. It used to be very common, as I already said, during iodine deficiency era. Now it's not so common. But again, rare cases of thyroid cancer also there. So they also can have swelling in the thyroid gland. They might present as a nodule over the thyroid, over the neck. So there are two conditions which can cause actually a thyroid related voice change. One is severe variety of hypothyroidism. So if it's an uncontrolled hypothyroidism for a very long time, which thankfully we are seeing less often, so that can cause some hoarseness of the voice.
Got it.
And if you have or somebody has a large thyroid swelling or a thyroid cancer which is pressing on one of the nerves which controls the voice, that can also lead to hoarseness, but that is actually quite uncommon. So most of the times we will be having patients who will have thyroid, who have problems related to thyroid underfunctioning, and they have other features as well.
Okay, and what are those common symptoms, Dr. Saptarishi? So for our audience, what are those very common signs which, if occurring, we could suspect that there is a hypothyroidism or underfunction of the thyroid?
Yeah, so again, that is something which is very, very common. So we get lots of queries. Some people do come and tell that I have this thyroid report which is written, but I don't have any problems. So it can be asymptomatic totally.
Asymptomatic, no symptoms. Okay.
So, but
that
again,
is possible.
That is possible. So somebody might get a routine lab test and the TSH suddenly is high. So TSH is the opposite hormone. So it's a hormone which gets secreted from the pituitary gland, and that controls the functioning of the thyroid. So if the thyroid is under functioning, so as a compensation, the TSH will go up.
So TSH is the one pushing the thyroid gland to perform better.
It's getting secreted from a gland in the brain called pituitary, and that pushes the thyroid gland to secrete hormones.
Okay, so high TSH means the TSH has to work more to...
Right. So the gland is under functioning. The body is trying to compensate by secreting extra TSH and trying to whip the thyroid gland to function and secrete the hormone. But again, sometimes if there is a major problem, it actually is not able to cope up with it.
So it's quite counterintuitive. So to make it simple for our audience, while it's called hypothyroidism, the thyroid gland is under functioning. The TSH hormone, which also comes in the thyroid report, is actually being produced by the pituitary gland, which may be high in such a case because it has to push the thyroid gland more.
Right. On the other hand, if the gland is over functioning in hyperthyroidism, the TSH will get suppressed or go down.
Relax a little bit.
So it's as a compensation, it will go down. So coming back to the symptoms, so if again there are you can divide the functioning of the grade of underperformance of the thyroid gland into two broad groups. One is subclinical hypothyroidism, where the TSH is borderline elevated. Roughly we take 1 to 4 or 1 to 5 as normal.
Got it.
So 5 to 10 so that is called subclinical hypothyroidism, might not produce any symptoms. More than 10, usually we see the symptoms related to hypothyroidism.
Got it.
What we most commonly try to always associate it is overweight or obesity. But again, I want to clarify. I think you asked that question in the rapid fire. So, if somebody is having frank hypothyroidism, overt hypothyroidism, maybe 4 or 5 kgs of weight loss can actually be attributed to the hypothyroidism.
Weight loss or gain?
Sorry, weight gain can be actually be attributed to the hypothyroidism. Other people come and tell that I have gained 10-15 kgs of weight, it's only because of hypothyroidism. That is not always true. We usually tell our patients that maybe 4 or 5 kg is because of hypothyroidism, but rest is because of your lifestyle or metabolism.
Correct.
So weight gain can be one of the features, but only to the extent of 4 or 5 kgs.
So it could be over attributed sometimes.
It's very often over attributed. People do tend to associate weight gain and obesity with hypothyroidism, but it's not always so. So that is why I think I answered one of the reasons why I said no to overweight and obesity.
Yes.
The other symptoms can be cold intolerance. So somebody might be feeling having difficulty in the winter season. So in Delhi it's quite cold right now, but people actually might be having more problem in the winter months.
Why does that happen, doctor? That's very interesting. Why does this scientifically happen?
So because thyroid hormone is the one which is driving your metabolism.
Okay.
So if your metabolism is slow because of hypothyroidism, the amount of heat, just to make it simple, it's slightly more complicated, but for everybody to understand, so your metabolism will be slow.
Correct.
Maybe the heat production will be inadequate, so you might feel more cold.
Got it.
So on the other hand, if you have they have heat intolerance. So hyperthyroidism will relate to heat intolerance. They might have more problem in summer months. So temperature loss, temperature perception related problems, cold intolerance is one symptom. Another can be hair fall, dry skin, constipation can be a problem, muscle cramps can be a problem. So, and again, sometimes we do have like fatigue, then loss of energy, all these things can be there. Also, in women, we can have difficulty in conceiving. Also, there can be irregularity in their periods. So, these are the other symptoms which can happen. But again, there is huge individual variation. So you cannot tell, if you have hypothyroidism, you will be having these symptoms 1, 2, 3, 4, 5, 6, 7, 10. Somebody might be asymptomatic, somebody might be having all the symptoms, somebody might be having 1 or 2 symptoms.
And doc, I think we are living in a world where, all of us have, say, 1 or 2 health issues. So the attribution, 1:1 attribution is also very difficult. Right. But what you mentioned is that there will be some weight gain probably. There will be cold intolerance, hair loss, skin issues. And then you mentioned constipation.
Right.
Also, there could be period problems or difficulty in conceiving. So if these issues persist, they could be correlated to hypothyroidism. Doesn't hurt to do a TSH or a thyroid panel test.
So if somebody has these problems, definitely they should go for a thyroid panel test.
Okay, got it. And Dr. Saptarishi, given the sudden uptick in the thyroid cases, right? And we see every third woman almost taking a thyroid pill. Adult women, what is really the root cause? Is it because of the higher level of diagnostic or testing, or is it something else?
I think partly it's because of more increased awareness. So we have the facilities to get ourselves tested, which maybe 20 years back hardly anybody used to get a routine health checkup.
Correct.
Now it has become affordable, so people are getting it done. So we pick up a lots of cases who actually on the basis of these reports only. On the other hand, so we are living in a situation where there are multiple other factors also. So maybe pollution can be one factor. So there are other like chemical pesticides, pollutants. So all these have an effect on the functioning of many of the endocrine organs, including thyroid gland. So maybe where some people, I used to practice in Noida, so I still go there for 1-2 days. So many people have told me, I've gone to Noida and I have developed thyroid after that. So
Let's not defame poor Noida.
Again, we sometimes the water quality, the amount of pesticides, the chemicals, they all play a role. So this is something which we need to research more. So how the pollutants and the pesticides and the chemicals are affecting the hormonal glands. This is an area which is undergoing intense research, but again the answers are just coming up. So we still can't give a very straight answer, but maybe increased awareness, more testing, and environmental factors do play a role.
And Dr. Saptarishi, what about stress? There's a lot of correlation of stress to hypothyroidism.
Yeah.
Especially, I think there is certain assumption because it impacts women more, and people assume women take a lot of stress. But is there a correlation?
I think you should have asked this in the rapid fire.
I didn't want to take you by surprise.
So anyway, I see is thyroid. If you try to understand the root cause, is an imbalance of immune function.
Okay.
The majority of causes of thyroid gland will be for a reason which is called autoimmunity.
Correct.
So autoimmunity is something where your body perceives that one of the organ in your body is a foreign body and mounts a immune response against your self tissue. Which it's not supposed to do. The immunity is supposed to take care of foreign substances.
Correct.
But if the body is mounting an immune response against your own tissue, it can be an autoimmune. There are multiple diseases.
Yes.
So there are studies and research which suggests that autoimmunity can be related to stress.
Okay.
So maybe it's very difficult to give a straight answer that stress can cause hypothyroidism or autoimmunity. But there are studies which suggest that autoimmunity can be precipitated by stress. So again, areas which are in the gray zone, it's difficult to give a straight answer, but maybe might have some role.
Okay, so basically what we're talking about is certain better diagnostics or awareness, and then you spoke about two other factors which could lead to hypothyroidism. There are environmental factors and stress, of course, but research is still going on. And we are in 2025.
And genetics also has a role. So if somebody has a family history, so autoimmunity is partly because of genetic factors also.
Okay.
So if somebody's mother or sister has a history of hypothyroidism, then also the chance of developing a thyroid disorder increases.
So in case someone has the symptoms we discussed early on, or has a family history of hypothyroidism, right? In that case, at least they should do the thyroid test more often to diagnose and treat.
Yeah. So again, it's difficult to give like for diabetes, it's easy to give. So anybody who is more than 25 and obese and overweight or having blood pressure or cholesterol problems, family history of diabetes, we start testing as early as 25 years. The foreign guidelines will tell 35 years. In India, we start doing it at 25 years because we develop diabetes earlier.
Yes.
And so for thyroid, usually it's symptom based. We do not usually ask for routine screening of thyroid problems. That is not part of any of the international or national recommendation.
Unless it's a part of a full body checkup.
So somebody is planning a pregnancy or is having difficulty in conceiving or is having any of these symptoms or so these are the situations where we definitely strongly recommend for getting a thyroid test done. Otherwise, it's good. It's a good practice to get yourself checked periodically, at least for diabetes and cholesterol and other problems. And once if you're giving the sample, you can very well give a thyroid sample.
Yes,
also.
yes, of course. If you're going through the pain of going through, the IV blood.
Yeah.
Okay, great. So, Dr. Saptarishi, we'll address the elephant in the room now and then go into the further details. A lot of people have questions around if I am detected with, say, thyroid problems or hypothyroidism, is it reversible by any chance? Or do I have to, if I meet the benchmark of the value, start with the medicine always?
See, again, so we need to, I started, initially I mentioned there can be two grades of hypothyroidism. One is subclinical, another is overt. So overt is like frank hypothyroidism. So if somebody has a clearly elevated TSH, which initially we had explained that is the marker of under-functioning thyroid gland.
Right.
So if it's usually more than 10 or so, and there's a test called for thyroid autoimmunity, so there are thyroid antibody tests also. So if TSH is more than 10 and the antibodies are positive, it's very, very unlikely that hypothyroidism can be cured.
Okay.
So your gland or the person who has it, that has been permanently damaged because of the autoimmunity. And we can, so what happens because of that? So we are having less of hormone in our body. So we are replacing that hormone from outside. So it's the body's own natural hormone we are giving in a tablet form. So for thyroid, we are not giving some chemical substance or drugs, which is a foreign substance. So it's the body's own natural hormone which is being given in a tablet form, which is a very, very natural form of therapy. If somebody's TSH is normal, so that person is probably normal from most of the aspects.
Got it.
So, but as of now, in medical science, if you ask me, is there a treatment where that autoimmunity can be cured and the thyroid can be made to function again to secrete the hormone which is supposed to do? Most probably, we don't have that science right now.
Got it.
So, if somebody has frank or overt hypothyroidism, the treatment is most probably lifelong. Even we have cases of congenital hypothyroidism by birth. Also, there are children who have thyroid disorders. They also need to take their medication, most probably lifelong.
Got it.
So the cases of thyroid which where we can discontinue medication is sometimes we start medication for pregnancy. For pregnancy, we have a lower threshold of starting thyroid hormone replacement. So many of the cases, many of the women who have hypothyroidism of mild variety during pregnancy, they can be taken off their medicine. Sometimes another confusion which actually is not part of the textbook, but what we practically see is that there is a lot of variation in the TSH lab values. So if somebody's thyroid report is borderline, say if the TSH is between 5 to 10, so rather than jumping on to start medicine and it's always better to reconfirm the test after 1, 2 or 3 months.
Okay.
So if your report is clearly suggesting that you have got a thyroid problem, most probably you need to start it and you need to continue forever. If your thyroid is borderline, unless somebody is pregnant, when in that case obviously we have a very low threshold of starting thyroid hormone replacement. In most other cases, it's better to reconfirm after 1 month or 2 months or 3 months. And if it's still high, consult your doctor. He might ask for some more tests. Maybe you need a reconfirmation before starting thyroid medication. So many of our patients come and tell, I had thyroid, but it got cured. But so most probably that person didn't have thyroid on the first place. So it was maybe some fluctuation in TSH can occur because of multiple reasons.
Got
The thyroid, the borderline thyroid cases which we get to know that has been cured are mostly those type of hypothyroidism which was most probably not there at all.
Got it. So what you're saying, Dr. Saptarishi, is that if the TSH is above 10, usually the doctor would do some thyroid antibody test, and if it gets confirmed, most likely there is certain damage and the hormone is given in its natural form as a medicine, which is safe to take. But if it's 5 to 10, unless you're pregnant, you could, repeat the test in 1 to 2 months and ensure that it is actually on the higher side. And given
maybe I would just correct you. Even if the TSH is 5 to 10, you need to do an antibody test. That is more.
Okay.
And the antibody test is more required if your thyroid function is borderline.
Got it.
So then that indicates that somebody is having a thyroid, undergoing a thyroid autoimmune damage.
Okay.
So if the TSH is more than 20, 30 or so, so even if you don't get an antibody test done, which will 90% chance be positive, so most probably the medication will be required. So if it's borderline, it's strongly recommended. If it's clearly above, you can get it as a part of the diagnostic armamentarium, but again, it's optional.
So you're saying the anti-TPO confirms basically the antibody test confirms it's an autoimmune disease.
Right.
Immunity working against it.
Yeah, right.
Got it. And Dr. Saptarishi, given you mentioned there are 2 types of these hormones, right? You mentioned there is thyroid, right? I think we call it T3, T4, and then there is TSH. So is it possible someone's TSH report is normal and T3, T4 is abnormal, and how do you handle those cases?
So again, these are complicated areas, but again I will try to make it as simple as possible. So, what happens if the thyroid gland, say somebody is undergoing an autoimmune damage to the thyroid gland. So, what happens is that the gland starts getting damaged. So, first, as a compensation, the first response is an increase in TSH.
Okay.
And in the initial part, that increase in TSH can drive the thyroid gland to produce the requisite amount of hormone. So if somebody's TSH is say 7 or 10, you might still have a situation where the TSH is slightly high, but the T4 and T3 is normal.
Got it.
So if somebody has a frank or overt hypothyroidism, usually in the range of, say, if the TSH goes up to 20, 30, 40, most probably even the elevated TSH won't be able to make the thyroid gland to secrete the requisite amount of hormone.
Right.
So in those cases, we might see that the T4 and T3 values actually have gone down and the TSH is usually in the range of 20, 30 or more. So we have situations like that. So most of the reports we'll see in our daily OPD practice will be like TSH in the range of 6, 7, 8, 9, 10, and the T4 and T3 is normal. Or even TSH 11, 12, 15, and the person will ask me that my T3 and T4 are normal, so why are you giving me medicine? So because T4 is normal. T4 is the hormone which we are replacing in a tablet form.
Correct.
So, but again, we have studies which suggest that if the TSH is more than 10, so if you start taking the replacement, so there are long-term benefits, including a positive effect on the heart. So, so that is why we are starting treatment for with thyroxine for hypothyroidism if the TSH is more than 10. Less than 10, there are multiple other factors we need to look into, and let your doctor take the call that whether you need the medication or not.
Right. Absolutely. This is just to address all the Google patients right now on this podcast. Doctor, of course, they must go through a valid prescription and, the right doctor consultation. So, Dr. Saptarishi, you touched upon a very interesting point that the medicine for hypothyroidism, unlike a lot of other diseases where the mechanism of action may be very artificial, this is a natural hormone that we are giving, right? So, it's absolutely safe to take, right? However, it's still a replacement therapy, we would say, for hormone. So what about the dependency impacts? What about the impacts on now my body, will go easy and not produce the amount of thyroxine which was actually being produced even early on? Are there impacts that arise because of this?
See, again, giving the hormone in a tablet form does not make you dependent. So if somebody actually has a thyroid disease, so as I said earlier, so there is no treatment to reactivate the thyroid gland. So say if somebody has been inadvertently given thyroxine, so maybe we had a wrong report, for some reason.
Correct.
So if the person is not actually having a thyroid disorder, so you stop the thyroid medication, the thyroid report will remain normal.
Got it.
So the gland, if the gland is functioning normally, if you are giving extra hormone from outside, so it's not like steroids. So we get to know about cases of people who have been taking steroid from outside, and the adrenal gland, which is a hormone which produces steroid in our body, that gets suppressed. So that is different. Thyroid is different. So giving thyroxine even inadvertently to a person who does not have a thyroid problem, so whenever you stop the medication and repeat the test after 2-3 months, the report will be normal.
Got it. That's a very good analogy you gave around steroid. Thank you so much, Dr. Saptarishi. Very clear. So what you're saying is a safe medicine, and if prescribed, must be taken as prescribed.
And actually, you have very robust tests to understand that whether the person is over medicated or not. So if somebody is, say, taking thyroid for a wrong reason, so sometimes people do feel that I have symptoms of hypothyroidism and I need to take thyroid medication even though my thyroid report is normal. So again, that is a wrong notion. So that person should not be taking it.
Of course.
But in those cases, if somebody is taking thyroxine from outside, the TSH, as we said, that is a controlling hormone.
Correct.
So that will actually get suppressed. So if somebody is taking slightly high doses of thyroxine for wrong reasons, you will have a lab report where the TSH has gone down, and the T3, T4 value, which is a marker of the thyroid hormone direct secretion, or either it can be from inside or it can be from outside. So that will go up. So we get to know. So even if you are treating hypothyroidism, we get to know whether you are giving extra dose, you are giving the right dose. So it's very easily tested. You just need to get a TSH.
So it's an easier disease to manage, probably,
so
doctor. You manage both thyroid.
So unless you want to make it complicated, it's a simple disease.
So which is a favorite disease to manage, Dr. Saptarishi, on that point? Given you handle all metabolic conditions.
So I think thyroid is a disease. At least 95% of people with hypothyroidism, they can be very well managed.
Okay.
So, but sometimes people try out other things. They leave the medication.
Right,
They try to do something else. So in those situations, it unnecessarily complicates. And you, just because you are taking a thyroid medication, you should not be complacent. And again, we started at that point that overweight, obesity. So many of our thyroid, many of the people with thyroid disorders, they will actually come with problems where the TSH is normal, T4 is normal, but still they are gaining weight. So again, this is to reinforce that they actually need to work on their lifestyle.
Correct. You cannot blame the poor thyroid gland.
You cannot blame the thyroid gland always.
Got it. Great point, Dr. Saptarishi. We'll cover a lot of lifestyle aspects as we go forward. So now just talking about the thyroid pill, the medicine, the natural hormone you mentioned, Dr. Saptarishi. How often is the adjustment to the dosage required for any patient?
Again, so this is something which is very important. So most probably it takes 6 to 8 weeks for the TSH level to settle down. So if somebody has been diagnosed with a thyroid problem, say the TSH value has gone up, and the doctor starts a medication, so starts a particular dose. Partly it will depend on the TSH, partly it will depend on the weight, what dose the doctor will prefer to start. So you need to at least give it 6 weeks to settle down, because if you are checking it after a week or so, most probably the TSH has not settled down. So it settles down slowly. So you need to give it some time. So if we are making any dose adjustments, then we ask to, maybe in pregnancy we try to be slightly more aggressive, because in pregnancy the effect is directly on the fetus, so we need to be more careful. In all other conditions, 6 weeks is a fair enough time. Then if somebody is well settled, we know, okay, this is the particular dose for somebody to have his or her TSH in the normal range. Maybe checking every 6 months is fair enough. So it's not that it's like diabetes where you need to keep a closer follow-up.
Oh yes, so, that's why I asked you which is your favorite disease.
So here, if somebody's TSH is normal, even every 6 months, 8 months is fine.
Got it. So what you're saying is, if someone is starting a new treatment, or dosage has changed, you can retest in 6 weeks. If you're stable, 6 months is good. And given, Dr. Saptarishi, we spoke about diabetes, and you mentioned regular monitoring is much required there, much more complex than hypothyroidism. Is there a correlation between a thyroid disorder and diabetes, and are they like, really, people say there are correlated diseases or they're sisters? Is it really true?
See, thyroid we started that it's an autoimmune disease. So there are again 2 types of diabetes. One, broadly 2 types. So there are obviously many other types. One is type 1 diabetes, which is also an autoimmune disorder. So 2 of them do have a direct correlation. Okay. So type 1 diabetes usually occurs in children and younger adults. So they are more predisposed to develop any other autoimmune disease, including thyroid disorder.
Got it.
So there we have a direct connection. For type 2 diabetes, so there are some studies which suggest it might have a connection. There are some studies which suggest that there is no connection. So again, a very clear connection does not exist between hypothyroidism and type 2 diabetes, the common variety of diabetes which we usually see. So again, some possible connection, but again a subject of research. So you don't have to worry about नहीं मेरे को डायबिटीज है तो मेरे को इसलिए थायराइड हो जाएगा, या मेरे को थायराइड है तो इसलिए डायबिटीज हो जाएगा. सो दैट इज नॉट द केस.
So this is also a myth.
For type 2 diabetes, I don't think you need to worry about developing, just because you have hypothyroidism, there is a higher chance of developing type 2 diabetes. There is no such evidence to
Don't
suggest
blame
it.
the thyroid gland and take care of your lifestyle.
Right.
Thank you, Dr. Saptarishi. Okay. So moving on to a very interesting topic which you touched upon actually quite a few times, which is thyroid and reproductive health, right? How the thyroid gland is important for the entire life cycle of reproductive health, from conceiving to having a healthy pregnancy to a healthy delivery. So
Right.
why this correlation, Dr. Saptarshi?
See, initially what happens is that if first of all it has a role in reproductive physiology, it has an important role. So maybe to maintain the regularity of periods, some role in ovulation. So you tend to even have polycystic ovary syndrome. That is also a very common female reproductive
Right.
disorder. So that also, those type of features can also occur with hypothyroidism. This hypothyroidism can sometimes mimic PCOS or polycystic ovary
Okay.
syndrome. So it's important for ovulation. It's important for proper fertility. So this is proven. So somebody who has a thyroid disorder is and is not getting treated properly can have fertility related issues or periods related issues. And when somebody conceives, at least in the initial part, the mother is responsible for the fetal supplying the fetus with thyroid hormone.
Right.
So the thyroid hormone is also essential for fetal brain development. So it's very important that we maintain what we call euthyroidism, that is neither hypo nor hyper, that is normal thyroid levels. So that is very, very important. We usually maintain a lower TSH in the lower, slightly low normal range. So that is important for overall preventing miscarriage, for the continuity of pregnancy. So only situation where you ask me how frequently we need to check thyroid function test. In pregnancy, the answer is different. So there we need to check maybe at 4 weeks. All other situations, depending on how stable your thyroid is, we can check at a longer interval. But it's very important that even for IVF, if somebody is undergoing an IVF, actually the TSH has to be in a narrow window where it's safest for IVF. So these are things which should be, so most reproductive doctors will look into it or will take the help of an endocrinologist to sort that aspect out.
Got it. Great, Dr. Saptarshi. So we do have certain questions coming in from the audience as well. I'll keep covering those, Doctor,
Yeah,
as we
sure.
go along. So one question the audience has is the impact of thyroid issues that we have on fertility. Is it both for men and women or only for women?
Primarily for women. Some role has been suggested for men also, but primarily for women.
Okay, got it. So great. If someone is planning to conceive or pregnant, very critical to keep your thyroid, report under check and
Right.
be under your gynecologist. Great. So now, just touching upon the subject of thyroid in men, Dr. Saptarshi, you earlier mentioned that not as common as women in the rapid
Right,
fire.
right.
But have you seen an increasing trend for men? And if yes, is that attributable just to the diagnostic awareness or anything else?
See, again, one reason why men and female, they have this difference is there is a difference in autoimmune disease between male and female.
Okay.
So females tend to have, women tend to have more of autoimmune disease, and men tend to have less of autoimmune disease. So primary difference, so there are genes in which are different, which make women more susceptible to develop autoimmune conditions, including thyroid. And so even if you see that conditions like rheumatoid arthritis or vitiligo, these are also autoimmune disease. They are more common in women. So
Okay.
one reason which is responsible for the higher rates in women is because of that. So men do tend to have autoimmune disorder. Maybe slightly increased tendency can be attributed to the endocrine damage related to environment and pollutants and chemical substances. So though that again not very clear picture, but more or less the incidence has been more or less stable. So
Got it.
but maybe slightly related to higher testing and more awareness. So earlier, maybe 30 years back, even if somebody had overt hypothyroidism, nobody tested. But
Correct.
you have the slightest symptom, you Google it and feel that, okay, I have thyroid disorder. So even if you don't have thyroid,
Right.
you will definitely
Correct.
get yourself
And I
tested.
think, Dr. Saptarshi, the inclusion of thyroid panel in the full body checkup, which is a driven test also in India is also a big contributor.
Right.
Otherwise, prescribing a thyroid panel test was a little bit more rare earlier.
Right.
Got it. And the symptoms of thyroid issues in men, are they similar to what we spoke about in women?
So again, slight tendency to gain weight, constipation, skin problem, then hair problem, cold intolerance, muscle cramps. So they're all similar. So
got it.
So maybe the females will have more of reproductive problems. Men might have to some extent, but lesser than females.
Got it. And Dr. Saptarishi, you had earlier touched upon a concept of thyroid issues and metabolism, and how that also leads to lesser heat in the body or cold intolerance, right? So metabolism has a huge role to play in our body, right? All the nutrients we derive are because of this very critical process.
Yeah.
So what is the linkage between thyroid function and metabolism, and how are they related?
So again, this is a complex question, but just to make it simple, so obviously thyroid is one of the essential hormones that will drive the metabolism. So it maintains normal rate of metabolism. So if your thyroid gland is under functioning, so your metabolism will tend to get slow. So somebody might slightly tend to get more weight. But what the exactly opposite we see is in hyperthyroidism.
Okay.
Because of an increased metabolism, because of the hyper functioning of the thyroid gland, we will always, most of the cases, will see weight loss. So people who have hyperthyroidism, the commonest cause is called Graves' disease. So they usually will present with weight loss and other features of metabolism. So there is a direct role of metabolism, between metabolism and thyroid. So the effects of another aspect of metabolism is also lipid. So what we also see is that only gets picked up on the lab test, does not it might not get, you won't get to know that your lipid levels are high.
Right.
But if you get a cholesterol test done and you have a uncorrected hypothyroidism, so cholesterol values will be higher.
Got it.
So once that gets corrected, the cholesterol level will settle down.
Oh wow, so it's correlated.
So one of the reasons which has been correlated, I told you somewhere that if you are not treating thyroid, the chance of heart problem actually increases later on. So that is because you tend to have a slightly higher values of cholesterol if your hypothyroidism is uncorrected. So somebody might argue, I don't have any problem, why do I need to take a medicine daily? So the answer is, so even if you don't have any problem, obviously it's causing some silent damage, and the chance of cardiac problem is going to go up later on in life.
Okay.
So it's important that if somebody has a TSH of more than 10, at least in a person who is less than 40, 50, 60 years of age, maybe in elderly we are slightly more reluctant to start thyroid medication. We need to be very sure. But anybody who is young, middle-aged, if you are not starting thyroid treatment at a TSH above 10, the chance of heart problem is going to go up.
Okay, so there is a strong correlation between
there is a correlation
problems and cardiac diseases, and Dr. Saptarishi mentioned
and the cholesterol is a connecting link.
Got it, Dr. Saptarishi. This is super helpful, and we have to protect our heart as much as we have to protect our thyroid gland. Okay, so we're getting a lot of questions from the audience on thyroid and diet, which we were of course aware will be the bigger element to cover. Just before we go there, Dr. Saptarishi, wanted to understand, some patients are advised ultrasound of the thyroid gland as an advanced testing, right? You mentioned there is thyroid panel, there is antibody test. But why are some patients when diagnosed, prescribed the ultrasound test for thyroid?
See, again, that is a very good question, and it's very often asked, and you will see prescriptions where USG thyroid or USG NEC has been written as a diagnostic test. So the primary reason is to find out a structural abnormality. So till now, mostly what we have been discussing for last half an hour or so was related to functioning of the thyroid gland.
Got it.
Most of the time, as the disease manifestation, that it will be that your thyroid is underperforming, or and more rarely it will be overperforming. So now we are touching upon a point, we are looking into the structure of the thyroid gland. So we briefly had mentioned that thyroid nodules and goiter were more common. So if you are suspecting that somebody is having a swelling in the thyroid gland, we need to, the ultrasound is the recommended test. Of course, you need to see clinically also. Ultrasound of the neck, which hardly has any radiation or anything, it's a very, very safe test. So ultrasound do not have repetition. Even in
course.
pregnancy, we get ultrasounds
Yes,
routinely.
yes.
So ultrasound is done to see the structure of the thyroid gland. So if the primary purpose of seeing a structure of the thyroid gland is to see whether there is a nodule or not.
Okay.
So if there is a thyroid nodule, then we need to do more tests to understand that what this nodule is made of. So again, thyroid nodule is not very uncommon. So people are starting to get ultrasound just routinely nowadays, apart from getting a thyroid function test from the
Okay.
lab. So somebody might feel I have some swelling. And we might see a nodule which again might be totally asymptomatic. So most of these nodules usually are benign. So 90% of them will be benign. But we really need to be careful about some subgroup of nodules depending on the age and the size of the nodule and the ultrasound character, where there can be increased risk of cancer.
Okay.
So if we are getting an ultrasound done, there can be some other reasons also. The primary purpose is to rule out a nodule or a discrete structure in the swelling in the thyroid gland. And if that is there, we need to do other tests to make sure that there is no problem in that nodule, and we can follow it up maybe by serial ultrasound or something like that.
Got it. Okay. So is thyroid cancer also becoming more common now, Dr. Saptarishi, or not really?
Thyroid cancer is becoming more common, partly again because of detections, because people do tend to get ultrasound more. But again, what has been seen, that thyroid mortality related to thyroid cancer fortunately has not gone up. So thyroid cancer is one of the most treatable causes of thyroid, one of the most treatable types of cancer. So cancer, we obviously have lots of doubts, and people actually get apprehensive if somebody gets a diagnosis of cancer. But again, even though the numbers have gone up, but the mortality related to thyroid cancer has remained stable. So that is something. So there are two reasons. One, we have better ways of treating it, and also because we are treating more milder varieties of cancer, mostly which wouldn't have got diagnosed earlier. So because we are getting ultrasound done routinely, and there is a needle test which is called FNAC, or fine needle aspiration cytology, we have access to this type of test more frequently. So we are picking up cancers which are not very aggressive, and the primary reason why the thyroid cancer prevalence has gone up or incidence has gone up is because we are picking slightly milder forms of cancer which might have remained undiagnosed earlier.
Correct. So it's for good actually,
It's
and
for
you can
good.
diagnose and treat early, and the mortality or death rate is very low.
Right.
Great to know that, Dr. Saptarishi. Now to address the most important queries of people, our audience, thyroid and diet, right? An open question. Every nutritionist has a different opinion. Some would say eat cauliflower, some would say don't eat cauliflower, some would say eat soy, some would say don't eat soy, right? So Dr. Saptarishi, coming from you, right, as an expert, correct, and having read all the researches possible on the subject, what is your take on good diet for hypothyroidism?
So again, you had asked me as a rapid fire question, and the answer is, see, autoimmunity do not have a proven connection to diet. So again, the cause is partly genetic, maybe stress, other factors. We still don't have all the clear answer, and the majority of causes of hypothyroidism will be autoimmunity. And once somebody has got a thyroid, so the diet does not actually play a role, because the gland has already been damaged because of autoimmunity. So whether you are taking cabbage or cauliflower or broccoli, it's not going to matter. So just to share a very interesting point. So this concept about cruciferous vegetables and their effect on thyroid, and they are goitrogens and they should not be taken regularly in people with thyroid problems, came from the fact that so there are some African tribes who still take this vegetables, cruciferous vegetable, as a staple food. So then the amount of goitrogen or thyroid damaging chemicals which get released from those cruciferous vegetables which are being taken as a staple diet, that is quite high. In an Indian context, if somebody is taking a broccoli or cauliflower or cabbage once a week, it's hardly going to interfere with your thyroid functioning. So I do not, and even the medical science does not recommend restricting cruciferous vegetables for thyroid disorder, unless you are taking it in bulk as a staple food.
diet, like the Africans of the older
So
times.
for soya, again, you touched a very important point. So there are some studies which suggest that soya can interfere with thyroid medication absorption. So again, unless you are not taking soya in bulk, so that does not damage the thyroid. Occasional soya chunks or anything do not have any negative impact. Even if you are taking soya oil, it won't have any negative impact. But if you are taking excess of soya in a person who has been diagnosed with hypothyroidism, is taking a thyroxine tablet regularly and maybe taking a soya milk just after that.
Okay.
In that case, the soya content might interfere with the thyroid medication absorption. So the primary reason we try to tell our patients who are taking thyroid medication is that, so you should not be taking excess of soya, because that will cause your dose to go up. It won't cause a major problem. So maybe somebody was controlled on 75 microgram, starts taking soya on a regular basis, the dose will go up to 100 microgram.
Got it.
So soya, again, in the quantity we take will not damage your thyroid gland. But if somebody is taking thyroxine tablets, will maybe slightly hamper with the absorption of the medication.
Got it, Dr. Saptarishi. Very clear. And any other critical to-dos or, do's and don'ts you tell your patients on the diet and lifestyle aspects if they have thyroid issues?
So I think the most important fact is that somebody who has a thyroid problem, hypothyroidism, has to take the medication regularly, early morning, empty stomach. At least the gap between anything else other than water should be 30 minutes. Some of the guidelines actually recommend a gap of 60 minutes. So if you are taking a thyroid tablet and popping in another, maybe an antacid tablet, or having a cup of tea just after 5 minutes or so that will interfere with thyroid medication absorption. So in order to get the thyroxine tablet absorbed properly, you need to give a window. Because this gets absorbed slowly, and if somebody is taking milk product, the calcium in the milk will chelate the thyroxine. So the thyroxine can't get absorbed properly. So again, that window of 1 hour or 1.5 hours after having thyroxine from taking any milk product, that is very important. So if somebody is again taking a calcium supplement or iron supplement, we recommend that you give a longer gap, because this all interferes with thyroxine absorption. So if you are taking the thyroid medication rightly, so early morning, empty stomach, it doesn't matter when you get up. So somebody is a night shift worker, tells अच्छा मेरे को सुबह उठ के 6 बजे उठ के लेना, it doesn't matter. So whenever you are getting up, you can take the medication. But the gap after that is important.
Okay. Very, very important subject you touched, Dr. Saptarishi. If you're on an acidity medicine, which is also taken empty stomach like thyroid medicine, even then the gap between the thyroid medicine and the acidity pill
has to be 1 hour.
1 hour. And
so it is very common. So we get so many of our patients who are taking, because the acidity pill is also prescribed by doctor in the empty stomach. The thyroid medication is also,
so take it together.
So they take it together, and the thyroid TSH value, which was controlled for a very long time, it goes up.
Very important. Great. And because we are Indians and tea lovers, you're saying even milk is contraindicated for the absorption, so there should be some
at least if somebody is taking milk, at least 60 minutes.
60 minutes. Wow, that's a lot of hard work. Wake up an hour advance of your morning tea. Got it. Great point, Dr. Saptarishi. Now, just on the lifestyle aspects, right? So, do other factors such as exercise or avoiding any addictive substances or good sleep or mindfulness, do they impact thyroid function or thyroid health?
See, again, so it's good to lead a healthy life. So just for your proper health, just to be healthy, you need to do the right things.
Right.
Just because you have thyroid, you don't need to do it. So otherwise, even if you don't have thyroid, you have thyroid, you need to do the right things. But again, if you ask me whether there are studies which have tried to analyze these aspects particularly in thyroid conditions, so there is not much of correlation. But overall, a good healthy lifestyle is recommended in all. So you should follow that as a part of your lifestyle.
Great, Dr. Saptarishi. We'll just cover a couple of questions we're getting from our audience, and some of them are common questions. Number one, I don't know it's related to your allopathy field or not, but people are curious that a number of people are treating hypothyroidism with homeopathy. have you seen any scientific correlation or betterment of patients in your practice? You could answer, choose to not answer. Sorry about that.
So I am not an expert in homeopathy. It's beyond my domain. So your homeopathy knowledge is as good as mine or as bad as mine.
Yes,
So,
but in your experience, in your practice.
So what I would like to tell here is that if you are getting a thyroid medication, that is the most natural form of treatment which is possible. So your body's hormone which is deficient is being given in a tablet form. So, and we have proper tests to know that whether you are taking the right dose or not.
Correct.
So if you are taking the right dose of thyroxine and if your TSH is in the normal range, so this is a very simple therapy. So this allopathic treatment does not have any side effects provided you are taking it in the right dose. If you are taking excess dose, if the TSH goes down, so this is a very safe form of therapy which allopathy is offering. So you can't have a safer way of treating in any other condition.
Got it. So allopathy wins.
but again, if somebody wants to try it out other things, it depends on them. But I am not eligible to comment on that.
Yes. Great, Dr. Saptarishi. That was very well politically handled. Thank you. The other questions that we are getting from our audience is, of course, on hair fall and skin issues. So, if a person is on a thyroid pill and thyroid levels are well managed and still has a lot of hair fall, right? Is it because of the thyroid issues?
So again, if you have controlled the TSH by giving the right dose of thyroxine, you can't actually do much more. So there is a very, very small subgroup of patients who require the activated form of thyroid hormone, which is T3, which is now available in India. But again, that is usually not the rule, more of an exception. So 98% of our patients usually do not require T3. So if the TSH is normal, we need to really find other reasons for hair loss. So three very common reasons which I will try, which I might point out, which I see in my practice. One is protein deficiency. You need to keep the macronutrients right. So Indian diet is poor in protein. So the protein intake should be adequate. That helps a lot in hair fall. So and anemia is another very common reason. In females, they tend to be slightly having lower hemoglobin, at least during the reproductive period, for obvious reasons. So correction of anemia is very important. And another is vitamin D deficiency is also very important. So again, these three, if you try to treat, then most probably you can correct the hair fall. Other than obviously you need to correct the thyroid also. So these are very common reasons which other than thyroid are responsible. If it still doesn't work, most probably you need to consult a dermatologist.
Okay. So what you're saying is, again, don't blame the poor thyroid gland if the thyroid function is normal.
If your TSH is normal, so we can't do much about it.
Okay. But protein intake and
hemoglobin and vitamin D deficiency. Right.
That deficiency actually leads to hair fall.
So there are some studies where protein and iron, obviously they have a direct correlation. And even vitamin D, there are some studies which they are helpful for hair growth.
Great. We'll take one last question, Dr. Saptarishi. It's been so great that I lost track of time actually. One of our audiences is asking, if someone is trying to conceive, how often should they keep checking their thyroid levels, given you mentioned the importance in a healthy pregnancy?
So again, very important that if somebody is trying to conceive, you should get yourself rechecked just before conceiving. Make sure that your TSH is in the right range for conceiving. And a very important message which is often missed. So you need to check the thyroid function test right after you conceive. And even if the TSH is normal, so this is in most situations where what we tell, your TSH is normal, you are taking the right dose of thyroxine, so you can continue on the same dose and meet me after 6 months or 8 months or whenever you feel like, if your TSH is normal.
Got it.
But if somebody has conceived and the TSH is normal, so as I had told earlier that in pregnancy the fetus actually takes thyroxine from the mother, because the fetal thyroid gland takes some time to develop. So initial part the thyroxine will go from the mother, so the thyroxine requirement goes up.
Got it.
So pregnancy is one situation. Just after conceiving, even if the TSH is normal, we increase the dose of thyroxine by 20 to 25%.
Got it.
So this should be anybody who is planning to conceive has a thyroid problem should be knowing this. So you need to meet your endocrinologist just after you have conceived, even if your TSH is normal, because the thyroxine medication dose has to go up. In pregnancy, we slightly monitor it more closely because the thyroid function test tends to fluctuate more often. So maybe in pregnancy 4 to 6 weeks will be a good time depending on how stable the TSH is. Otherwise, in all other situations, if somebody's TSH is normal, just lead a healthy lifestyle, check intermittently, maybe once every 6 months, and keep on taking the right dose of thyroxine. So many people tend to, my TSH is normal, my disease I have been cured, so I need to decrease the dose. Again, they will end up with a higher value of thyroxine. So these are common mistakes which are there. So unless you try to make it complicated, this is not a very complicated disease.
Great. Thank you so much, Dr. Saptarishi. It's really heartwarming to see a celebrated doctor like you talk and discuss about these important topics in such simple language. Our audience learned a lot today, given January is dedicated to thyroid health.
Right.
It was our privilege to host you. A big thank you, Dr. Saptarishi,
Thank
to
you.
you
Thank you
and
for
to
inviting
Apollo
me.
Indraprasth Hospital for allowing us to share these important insights with our audience today. Thank you. I
Thank-
thoroughly enjoyed this session.
Thank you so
Thank
much.
you
So
again.
did I. Thank you.